Hello, hello. Thanks for joining. My name is Dan Ariely, and I'm the James B. Duke Professor of Psychology and Behavioral Economics. And we're here today to discuss this crazy crisis we're in from a social science perspective and think a little bit together about the future. The plan is for me to talk for about 30 minutes and then to get questions. So please ask, and hopefully we'll be able to get to some of those questions. Okay, so first of all, a little bit about kind of the Corona crisis through my eyes. So about a month ago, I was very happily at Duke. Things were closing down, but my research lab, the Center for Advanced Hindsight, was going strong. People were working hard. And then I started getting lots of phone calls at all hours of day and night, mostly from the Israeli government, but a little bit from the British, a little bit from the Brazilian, about the Corona crisis. And the talks became more and more intensive. And then eventually I realized I can't help from Durham to Israel. So I showed up here in Israel about a month ago. I'm basically been on this chair almost constantly, and helping different parts of the government. And I'm telling you this, partly it might be interesting, but partially because it kind of helps, I think, and help explain the role of social science in all of this. So when I came initially, the challenge was how to give instructions in ways that people could basically adhere to them. You know, if we say to people, don't leave home, that's not going to be likely. There's a limit to how much you cannot leave home. And then if you break the rule once, are you going to keep on breaking it? If we say, don't leave home unless it's for the supermarket, maybe we get people walking to the supermarket back and forth all the time. So we started thinking about how to help people get instructions. And it was very clear that the principles were tell people what not to do, but tell people also what to do. You can't just leave a vacuum of what to do. You have to make it look socially acceptable and socially desirable. And indeed, we got some campaign to get people to adhere. In general, things have been successful. So far, you know, Israel has about 15,000 people who are sick, and about 1% of that, about 170 people who sadly passed away, but there's been a dramatic crunch on that. The next challenge was to think about what to do with the Orthodox community. And the challenge that started today was what to do with the Muslim community. And the Orthodox community was because some of the Jewish holiday, the Muslim community was because of Ramadan, the Saturday, and the rules of religion for people who believe in God are much above the rules of the state. How do you make it happen? It turns out the same principles apply. Tell people what not to do, give them alternatives, how to pray in a different way, how to do other rituals in a way, and then make it desirable, acceptable, the thing that everybody does. Okay, so that was kind of step one. Not easy, but that was step one. Step two was to try and help the education system. All of a sudden, the education system had to teach remotely. Guess what? Nobody was prepared for that. And we started studying what worked better and worse. So we created a study in which we studied the characteristics of each teacher and each subject and the particular environment they're teaching from in their home, and the material that they're using, and the student and their study environment, and their parents and other siblings at home. And we're trying to identify sweet spots. So you can say, you know, from all of these combination of all of these things happen, what are the combinations of teacher characteristics, technology, subject material, student environment, student characteristic of their home and siblings that make things look better. And we hope next week to have some conclusion to try and figure out how to advise the education system to move forward. Then we learned very, very sadly, and that's true for the whole world, that domestic violence is on the rise. Some against women, a lot against kids. And, you know, it's unbelievably painful to be part of those discussions and to realize that domestic violence is increasing. And I'm by far no expert in this, but we've basically started creating two approaches. One is for adults, and the approach for adult is recognizing the pressure that they're getting and the stress and how stress gets out, and get them to try and understand and control their own stress. And then for kids, we have a chatbot that checks on them once a week in all kinds of ways. And then if we see that there's traces of verbal or physical violence, we go more deeply into that. There were, of course, lots of questions about the stimulus package. You know, you can give $1 in different ways. You might not remember, but in 2007, 2008, we had two stimulus packages that came from Bush and from Obama. And they were very, very different. Bush gave people a check, and it was a refund check that we got of our taxes. And Obama decreased the taxes people got, so it was a small increment to the salary. It turns out none of those had a big impact on the economy. Bush's approach gave people money back in a way that they thought it was theirs anyway. So why spend it, right? You could say, here's a refund check. That's a very different framing than saying, here's a check, the government's money, go and spend it. And Obama's plan had a very small amount of change, and it didn't really get people to spend more. But anyway, those are two programs. Now we're talking about much bigger amounts, and of course, is what are some ways to take money and get it out in a way that would be efficient. Of course, the government money is not going to be enough. So we have a big drive now to get people to donate more money to charities. We have a big drive to get people to buy in advance from companies. Imagine that there's a place that I like coffee. How about if I would spend $500 for the whole year next year, and I'll prepay for coffee? And now that company could get some money in advance, and the liquidity could increase. And we're also tracking movement in the country, trying to get an understanding of how many people are moving and not moving, staying at home, just going out, going to grocery stores and so on, how many people are violating the rules. We created an index, not just for the whole country, but per city, and we're trying to get city mayors to compete on those index. When we originally came out with that index, I got lots of calls from lots of angry mayors. They thought that I'm doing something, you know, against them personally, and it was tough to explain to them that's just the data. Let's focus on what we could do to help, not on why you're last place. And we're now trying to come up with a very complex index about the cost of the actions to slow down Corona, right? So, of course, it started by being about saving lives and not reaching the capacity of the healthcare system. But there are other costs. There are costs for people staying at home. There are costs of people not doing preventative care. You know, the number of colonoscopies and mammograms has gone down. There's cost of the fact that people are now afraid of going to hospitals. So even people with cancer treatment sometimes don't go. We had a few cases of people that had heart conditions that out of fear stayed at home and then sadly passed away. How do you take that into account in the calculus? And then, of course, there's the question of economic growth and the cost in general. So anyway, those are the kind of things that we're dealing with. Oh, of course, there's the question of how do we get out, right? What are the steps to go out? Again, what are the instructions that we can give people that they would adhere to? If we say, be home with very limited amount, that's a relatively easy, simple instructions to follow, relatively speaking. But if we say, you're free to go out, just please keep social distances and don't go to too many places, now the opportunities for messing up is going to be very, very high. So those are some of the projects that we're trying to deal with. And you know, it's very clear how needed social science is. It's true that, you know, this is mostly about, you know, biology, and we're trying to understand the virus and what are its characteristics and how do we create a vaccination medication, what's the role of antibodies, lots of models of epidemiology. But at the end of the day, we have people, and people have to change behavior, and we have to take into account in the models that we do, how do we get people to actually change behavior. Anyway, so that's my life. Maybe I'll say one more thing. You know, my regular research at Duke at the Center for Advanced Hindsight, we mostly study financial decision making in health, and we study financial decision making of the median and lower, how to get people to better use food stamps and pay back loans and not to spend too much and create emergency savings. In health, how do we get people to exercise, take their medication, sleep better? And generally, kind of in a regular month, I go through ups and downs. I feel that we're making some progress, and then I feel that bureaucracy is against us, and I feel that you know, there are too many people who are kind of just needed, and we're not able to help everybody. And then I feel, yes, we are making progress, and there's like a cycle of hopefulness and feeling of success and less, and it goes on. And now in Corona time, it's basically the same thing. It's only happens, you know, 3 times a day. Where I feel we're making some strides, things are going back. Just the magnitude of the problem is tremendous, and the barriers that are standing in our way are amazing. This is going to be a very, very tough period, and to see people who are, you know, already losing their home and losing their businesses, and to get people who are so lonely, just incredible. In Israel, we had Memorial Day. We'll have Memorial Day. We had a Memorial Day for the Holocaust victims a few days ago, and we'll have the Memorial Day for all the soldiers who died in the country on Tuesday. And they're not going to allow family members to go to the graves of their loved ones. Right? What a terrible challenge. One of many, right? There's so many of them. Okay, so complex, difficult, very good for a social scientist in some ways. My first book, Predictably Irrational, came out in the beginning of 2008, exactly when the financial crisis was hitting, and it was I didn't time it, of course, but it was a really good time for a book about irrationality. And I said, hey, people are irrational, and here the financial crisis came to pick it up. I don't think I needed the coronavirus to gather more evidence that people are irrational, but you certainly see a lot. Okay, so I want to share some more thoughts with you, and there's one more project I didn't tell you about. You know, for a long time, we have been trying to study work from home. If people work from home, they don't need to drive. It could save them time. It could save a resource for the environment, reduce traffic jams, all kinds of good things. But guess what? We had a really hard time getting people to do this experiment with us. We would go to an employer and say, hey, let's do a study of getting people to work from home for a month. And people said, you must be kidding me. No way that I can do that. Well, guess what? we got that experiment. It's not a perfect experiment, and people now working with kids at home and so on, but still, we got people that we never thought would work from home to work from home, and it's a good opportunity to study this. So if you have some time, please take this study. It's a little long, but I think you'll learn a lot from it, and we will learn a lot from it. I think we'll mail you the link after we finish today, and if you can, share it around, because we're trying to get a very large sample to understand this issue. Okay, so let me say kind of a few general things about how I think we got here and some things to think about. So why did it take us a while to act? And there are many reasons for that. One of them is that viruses are invisible enemy. We don't see it. And we're used to thinking about viruses and not being that afraid, right? We all have experience of having viruses before. And the moment something is called a virus, we put in the category of other viruses and we say, hey, we've had this before, we don't see it. We're not that afraid. If it had a different name, right? Just imagine it was not called a virus, it had a different name, maybe we would have been a bit more worried. But the moment it was called the virus, we have a mental model of what viruses are. And having a high mortality rate from a virus is not part of our mental model. There's also the issue of small probability events. Think back to the time when you were still driving, and think about something like texting and driving. Imagine that you think that the probability of texting and driving and something bad happened is about 1%. And one day you take a risk and you text while driving and nothing bad happened, it's only 1%. But at the end of this texting and driving, do you say to yourself, oh, it was 1% chance, it's still 1%? No. You basically say, oh, I have experienced this as being less dangerous. I've experienced this as nothing bad happened. And now you update your probability. And maybe you think it's 0.9. So basically, when things are having low probability events, every time we experience something and we don't learn a negative lesson, we don't get hit by another car, we get the wrong impression that it's safer than we thought in the beginning. And of course, with viruses, I was in New York City when the virus happened. I must have met people who were sick. I don't think I got sick. We experience things in a way that make it harder for us to learn about things being risky when it's a small probability event. And then, of course, it also takes a while, right? So you could get sick, nothing happened, or nothing happened for a while, and therefore we misbehave. So that's kind of we can talk more about that, but that's kind of topic number one about why is it difficult to react very urgently to things like a virus. The second thing is about the political perspective. And here too, I have a long list of factors that I think are contributing. But let me kind of focus on a couple of them. In the coronavirus, we have fight for in the coronavirus. We've all been recruited, and we are spending a tremendous amount of time and effort to save lives, right? And one way to ask is this consistent with what we have been doing all the time? So for example, the best estimates we have is that to save a life of a child from malaria, it costs about $3,400. Have we been interested in doing that? No. There are lots of kids who are dying from malaria. There's lots of ways to save life by fighting infections in hospitals, for example, or reducing obesity, or reducing blood pressure problems. There's lots of things that we do, and if I all of a sudden gave you $1 trillion and I say, go ahead and improve healthcare, you would find lots of ways to increase health span. You would get people to live much longer in all kinds of ways. But if you think about our history, we didn't seem to care that much. In fact, older people in society, sad, very, very sad to say so, but people did not rush to save them. We didn't see a lot of outpour of attention and wanting to spend more money and so on. Clearly, the Corona time is something very different. If you just looked at the Corona time and you were an economist and you would say, let me figure out how much people care about the lives of people who are in high risk and relatively old age, you would say, oh my goodness, people are just care a lot about that. If you looked a year ago and you say, how much do people care? You would say, not that much. So what has happened here? Why is it that we show so much care now and did not show so much care before? I think it's about the nature of Corona. In psychology, there's something called the identifiable victim effect. And if you remember, there was baby Jessica. Some of you might remember her. Baby Jessica fell to a well. She was stuck there for a while. It was very sad. Eventually, they released her. The person who released her got his picture. It was a fireman on the cover of Time magazine. It was covered in all the television stations. Baby Jessica, she must be in her early 20s these days. She got lots of donation, but she also got more TV coverage than Rwanda and Darfur put together. So there was something about baby Jessica that got us to care and give her money. By the way, they gave her money after she was out already, which is a nice thing to do, but it didn't solve the problem. On the other hand, there are lots of tragedies that we don't seem to care about. And the analysis of the baby Jessica effect was the identifiable victim effect. You identify one person, your hearts go to them, and you want to save them. Or think about another example. Imagine that you walk over a bridge. You walk over a bridge, you're on your way to a job interview. And you have a new suit and new tie and new socks and new underwear and new shoes and everything is new. And you're going for your dream interview for your dream job. Absolutely amazing job. And you walk over this bridge and all of a sudden you hear a cry. And you look over the side of the bridge and you see a baby about to drown. And you know that if you'll jump and save the baby, you'll not get your job. Now, the rational economist would say, go and get your job and promise to donate 10% of your income to save babies. With 10% of your income, you'll save much more than saving one baby. You'll get your dream job and you'll save lots of babies. That's a better outcome. But of course, none of us can think this way, right? It sounds cruel, inhumane, this cold rational perspective. But it does show that sometimes our actions are designed to satisfy our emotion and not to make the optimal global solution, because of course babies die all the time, and for a very small effort we can usually save a life or improve a life, and we usually don't do it. So something happened with the Corona. It was the idea that the whole world was surrounded by it. It was in the news. We were interested in this. We had the image of people dying without ventilators, and that's a very, very tough image. So all kinds of things happen, and as a consequence, we are pouring an amazing amount of resource into this issue, not necessarily in the most rational way. I added some other factors here, but the last one I added is consistency bias. And consistency bias is our desire to repeat our actions. We basically don't like to admit when we're wrong. And it means that once we get a particular action going, we're likely to keep on with the same action. I mentioned opportunity cost. I want to show you two quotes from opportunity costs. The first one says, my budget includes the largest increase in defense spending in 2 decades because while the price of freedom and security is high, it is never too high. Whatever it costs to defend our country, we will pay. That's one approach. The second approach, and I'm trying to, the screen is, I have to move the screen. The second approach says, the world in arms is not spending money alone. It is spending the sweats of its laborer, the genius of its scientists, the hopes of its children. The cost of one modern heavy bomber is this: a modern brick schools in more than 30 cities. It is 2 electric power plants, each serving a town of 60,000. We pay for a single fighter with 500,000 bushel of wheat. We pay for a single destroyer with new homes that could have housed more than 8,000 people. This is not a way of life at all. It is humanity hanging from a cross of iron. Now, you might say, maybe the person that gave the quote on the left understands the military. Maybe the person who understands the one on the right doesn't understand anything about the military. But the reality is that the person that gave us the quote on the left is George Bush, who took lots of pictures in the military, and the one on the right was Eisenhower, who was certainly very knowledgeable about the military. But the point is that when we do make decisions, they have opportunity costs. And one of the things we haven't really considered very carefully and is the opportunity cost of the actions that we're taking.
Hey, Dan, I'm just going to jump in and ask you if you can advance your slides. We're only seeing still the first title slide.
Really?
Yep. Sorry.
I see the new ones.
Can you try unsharing and then resharing your screen?
I can stop share. And then let's reshare. You missed such good slides. My goodness. Let me see. So maybe I'll share the whole slide. Do you see it now?
Yes, thank you.
And now?
Yes.
Okay. So you missed a lot of things. So we'll send you the slides later. But we had topics that we covered, and this is the okay. There's one more topic I want to cover, which is something called learned helplessness. And maybe I'll stop sharing for a second and get bigger on your screen. There's no question that there's a lot of anxiety around these days. And there was a very famous and disturbing study about learned helplessness. In that study, there were 2 dogs. The dog in room number 1 got light, and a few seconds later, electrical shock. Light, electrical shock, light, electrical shock. At random times, the light would come, and then in a fixed time after that, the electrical shock would come. The second dog just got the electrical shock. The same time as dog number 1 just got the electrical shocks, but there was no warning. Now think about the difference between those 2 cases. One has a predictable amount of pain when it's coming, and one has unpredictable amount of pain. What's happening? And then they moved both of those dogs into a new environment, one at a time. It was a room with a partition. And from time to time, a bell came up. And if the dog stays in their side of the partition, they got electrical shock. And if they jumped over the partition, they escaped it. The first dog, the dog that had the predictable life, walked around, got some electrical shocks, explored their environment, and figured out at some point that if jumping would get them over the electrical shock, would eliminate it. The second dog basically was just whimpering. The second dog just laid there on the floor. The second dog just lost all hope that they can do something in the world. And that's the term learned helplessness. And the idea is that we have a tremendous amount of resilience, but to have that amount of resilience, we have to understand when things are coming. We have to get instructions that are clear. We have to have a vision for the future. We can stand the electrical shock if we know when and why and so on. And part of the challenge of this period is that things are so unclear, right? It's so unclear what instructions are coming, where they're coming from. If you think about what the leadership is saying, it's very hard to be consistent and understand understand this. Okay, and now I want to move to the next topic, and I want to talk a little bit about. I'm hoping you can see my screen. Yes. Sonia?
Yes, it's working.
Great. Okay. So I want us to think a little bit about what things are going to stay and what things will not. So imagine the following case. Imagine there's a range of behaviors, and it includes everything, all the things that we do. And we had all kinds of behaviors before Corona time. And we had going out to eat and coffee and going for vacation, and we had going to work and kids going to school. We had a large range of behaviors. And then during Corona time, we had some of those behaviors, right? Some of the before Corona behaviors stayed, and some new ones came, for example, staying late and watching Netflix. And that's this period now. And then there's going to be kind of, in my mind, two important periods. The first one I call the day after, in brackets, because this is not really the day after, it's during Corona times, as we start to understand, relax, live with Corona for a while. And we don't know how long it will be, but let's say it's a year. And then we have the time after that, which I called the real day after. And I separate into three components, Y, X, and Z. And the question is, what kind of behaviors will we have? So here's kind of the idea. The idea is that during quarantine or heavy restrictions, this is now. The day after is restrictions are going to be slowly lifted, and we're going to change in all kinds of ways. And then at some point, they'll tell us that we don't need to worry anymore, and then there'll be kind of three types of behaviors. There'll be behaviors like Y, the top one, which will basically, the habits will go back to normal. They would increase and change, and I think TV watching will be like that. Maybe we'll even watch more TV than we did before Corona. There'll be some things that will stay the same. They will not change when the Corona threat would go away. And there will be some things that will disappear. And I kind of gave a scale here for TV watching to Disneyland. And I'm not hoping that Disneyland would go away. But if you think about Disneyland as a category, it's an activity that relies on lots of people to come together in small proximity. And the longer Corona crisis is with us, the less and less likely that would be. I don't know about you, but when I now watch a movie or something and I see two strangers hug, kind of my first reaction is, oh, be careful. It's almost like a horror movie to see this thing happening. I think it will take a long time to cure. So we'll have these three periods. Now, I wrote here on the bottom, does it have to be this way? And I think the answer is no. There are things we can do to shape habits. So, if we take Corona days and the day after without any effort, I think we'll certainly get more TV after that. We'll get less reading books. We'll get more looking at the news very quickly, many times a day. There'll be all kinds of things we'll get. We'll get less sleep, less exercise, all kinds of things like that. But I don't think it has to be this way. I think we can try to create better habits. And that's one of the hopes of the Corona time, because we have time now. We have some amount of time, unknown exactly how much, to either get sucked into bad habits or get into better habits. So for example, for our education system here, we're recommending that kids end each day by reading a book in bed, right? That's a good habit to get going. On the other hand, if you didn't do that and it would be TikTok that would fill their time, there's a good chance it would keep on going after that. We try to get all kids to write something in a diary every morning, because if they do that, there's a good chance that this habit will stay, and if they don't, it will likely go away. And these habits are for all of us, right? I'm sure we all have a list of things we would like to change in our lives. Sleep, meditation, eating, exercise, spending time with loved ones, all kinds of things like that. We can actually think about how do we deal with this in period 1 and then period 2, so that we have good habits in period 3. Okay. I'm going to skip the issue about employee motivation, goodwill, and loyalty. Maybe we'll do it in another time. 2 last points. We have been designing systems basically for resilience. Oops, I need to figure out how to do this. Okay. We have basically been designing a system for efficiency, right? We've designed a system for efficiency. An ideal airline is an airline where the planes land, get refueled, people get out, food is being put in, and it takes up again. An ideal hospital is one that has 0 extra capacity. All the beds are being used. An ideal business is a business where the raw material comes in, gets used, and gets shipped out all in real time. Basically, cut the fat out. That's the opposite of resilience, right? Because if you have a system that is perfectly attuned, it's perfect when everything is perfect. But when something goes wrong, then the system can get into real trouble. So we've been really good at building system for efficiency and almost no system for resilience. And the Corona crisis, I think, should let us rethink about that. By the way, the only system that we have that is not truly built for efficiency is the military, right? The military, you don't say, show me your exact needs right now. No, the military is all about planning for all kinds of scenarios and being ready for all kinds of things. You don't say, let's make it efficient. You say, let's be prepared for a large range of things. And then the very last thing I want to say is that for me, maybe the most bright side of this crisis is that there has never been a time in modern history when it is so clear that our future is both fragile and that we're so connected. Different countries, right? We can think ourselves as not being aligned. Corona came and said, no, you're all in the same boat, right? If the Chinese have a bad relationship with the Americans, the next the next virus, if it comes from China again, they will not report it in the same. We're all in it together. And not only are we all in it together from different countries, we're all in it together within a country. Imagine a situation in which 10% of the people don't pay taxes. We have the US, 10% of the people don't pay taxes. We have 10% less taxes. That's it, right? It's a linear. Every person who doesn't pay taxes, we have less taxes. What about a world in which 10% of the people don't adhere to the rules of social distancing? If you're feeling sick, isolate yourself and so on. Their effect is not 10%. They can destroy everything for everybody, right? You can have, and we've seen that, right? We've seen super spreaders. We've seen super spreaders took the corona from Italy to Argentina, and we've seen super spreaders in all kinds of places. You don't need a lot of them. You need a few people who just seems to be walking a lot and don't care. And we've also seen people with low income who don't feel they have a choice. So even though they have symptoms, they go to work and meet people. So for me, it's an important proof of how connected we are, right? If we don't take care of everybody, we're all going to pay the price for that. And maybe it's a good lesson for how we continue to run our lives. So with this, I will stop here, and I will take questions, comments, concerns. Okay, so one question that I have here from Paul is, does shared adversity tend to make us kinder or more selfish? Very, very good question. So we sadly don't work out very well when we're afraid, right? When we're afraid, our first instinct is survival. It's not caring about others. So shared adversity is very good if we're not individually stressed. So if you look at how we're functioning as a university, right? You know, we are, I mean, it's amazing. It's just beautiful. The camaraderie, the caring, the way people participate, people volunteer. I mean, it's just an amazing thing. Now, is it a difficult time? Absolutely difficult time. People's research was stopped, education was stopped, lots of things were stopped, but nobody feels individually threatened, right? Nobody feels that they will not have food on the table next week. So in conditions of adversity, without threat, adversity is incredibly helpful. But take other cases into account. If you've seen, you know, we see it from tracking people here in Israel, but you see it also from the Google Trends in the US. Adherence to the Corona rules are very much based on level of income and social economic status. Very, very tough for some people. So if you're not sure, or you saw the people who are delivering food and things from Amazon about how unhappy they are not feeling camaraderie. They are feeling extra stressed, and this is not the right case for camaraderie. This is, by the way, another reason to be more clear about the stimulus package, right? So if you have people who are traumatically stressed, that's not the time to create camaraderie. So I mentioned kind of learned helplessness, but communicating, you know, the government is here, we'll support each other, how will this work is incredibly important. I don't know if you saw how New Zealand dealt with the coronavirus, but their prime minister is amazing, right? She stands, she communicates, she tells them where they're going, lays out a plan, promises people that if they can't pay rent, they'll help them. I mean, very much eliminating this survival need and laying out the plan. So no survival need and a plan for action, which is incredibly important to feel that you have some agency. Okay. Next question. If I were hired to run a campaign to encourage Americans to donate their stimulus relief check to a charity, how would you design it? Okay. So first of all, we are doing something like that. But I'll tell you how I would do it. The first thing that I would do is I would get people to reflect on how lucky they are, right? Because to basically be willing to take something from us and give it to somebody else, we need to reflect on that. So I would ask people on a scale to say how lucky you are. And the reason I would do that is that answering questions is often the best way to get people to reflect on something. So if I come to you, this was Carol, if I come to you and say, Carol, you're really lucky, it's not the same. If I say, Carol, how lucky are you on the range of all the people in the world who suffer from the corona, that would be more impactful. So I would get that. And then I would ask you to estimate the devastation of the corona. I would say, how many people do you think are going to lose their job, and how many people are going to lose their homes. And I will ask you 2 or 3 questions to understand the magnitude of devastation. And then I would ask you to pre-commit. I would not wait until you receive the check, because if you receive the check and you deposited, it's going to be harder. But if you commit beforehand, that will be easier. By the way, we also see that, for example, we've been doing campaigns trying to get Americans to pre-commit to save their tax rebate. And if you get people to do it early on and promise, they save much more than if you wait until they get their tax rebate check. And then the other thing is I would make it socially desirable and normative. And I don't mean normative in the economic sense. I mean, that's the norm. That's what people should do. So, for example, in Israel, when we've been trying to get people to donate their stimulus check, we got lots of opinion leaders to basically lead with that, right? And they do it in a way that doesn't say everybody should do it, because not everybody should do it, but they say, if you have it, you know, we need to help each other. And it comes from all kinds of people who are opinion leaders. Okay, next question. Fear plays a big factor in getting people to follow the rules. But then the opposite force is the need to socialize, earning a mental, physical fitness. How long can fear drive the behavior? So fear is a tough, emotions in general get invoked in us and then they dissipate. Even the good ones, right? Emotions don't last very, very long. And in the case of fear, I think all kinds of governments are trying to use fear to get people to adhere to some rules. But then fear doesn't work for very long. And ironically, if the fear worked and people stayed more in social distance, then they look around them and they say, it wasn't that bad. Why did they frighten me so much? Right? And fear, A, is not a sustainable long-term behavior, and B, it's not a recipe for adherence in what I call the day after case. So fear is very good for stay at home. Don't do anything. Stay at home, stay at home, stay at home. Fear is very good for that. If you start to tell people, you know, go to work and come back, go to the supermarket, but try to wear a mask and don't try and do too much gathering, that's not fear, right? That's fear is more approach avoidance, do and don't do. And what we need is to move quite quickly to something more nuanced than that. And because we used fear, it's a little harder to move to something else. And I see it here, right? People are used to seeing the numbers. Here's the number of the dead, and here's the number of the people who are sick. And those two numbers can at best stay flat. They can never get better, right? It's cumulative numbers. These are numbers that are designed to create fear. If you wanted to create fear, show the cumulative number of people who've been dying. If you did not want to show fear, you would show the number of people who are dying from corona compared to the people who die in a general, in an average week, right? That would be very different. You would show the people who've been tested positive compared to the number of people you've tested. I mean, there's lots of things to show, where you would show what happened the last week, not cumulative the whole time. But yes, we're getting people used, I think, to too much fear, and that will make the transition to living with corona tougher. And I'm mostly worried about the people that feel that are high-risk populations. We pumped into them the fear, we pumped the fear to all of society, and how are they going to leave the home, right? What's the next step? And could they psychologically leave home after being so afraid? So I do worry about it. Okay, the next question. Rafael from Chile. Despite globalization, why we couldn't organize a coordinated response, and why is it so irrational, the first step taken to stop the virus getting out of China? Yeah, so first of all, our research center is called the Center for Advanced Hindsight, because we want to remind ourselves that in hindsight, everything is simpler than in foresight. You could have said, let's realize that one day we'll have another virus and let's prepare for that. But there's lots of things to prepare for. We need to prepare for terror attacks. We need to prepare for cyber attacks. I mean, there's lots of things to prepare for. And I understand that we can't be prepared for everything. And maybe we should have prepared for it, but we can't say we should have prepared for this, because there's a lot of things that we need to prepare for. I'm not sure that's the highest likelihood to have happened. But the question of why couldn't we work together, it's because we just don't. I tried from time to time to spend time in the UN and help them on their behavioral team, and sometimes I meet the delegates. We just don't work together. It's heartbreaking, but we compete, and we don't work together, and we often work against each other. And science is the only thing that sort of is collaborative, right? I have colleagues that I work on projects from all over the world. But even for science, right? Funding from the US goes to US scientists, and from Europe to European scientists. It's not truly, it's more collaborative than anything else, but it's not truly collaborative. And by the way, I think it's a beautiful hour for science, right? You see universities and pharma companies and people are working and making amazing progress, working very hard. So I think it's a science most beautiful hour. Hopefully they'll come up with something, right? It's a gamble, but hopefully it would work out. But for me, one of the issues is that we do have to work together in a much deeper way. So and there are conditions to work together, and one of the conditions is trust, and we don't have that much trust, right? If you ask yourself, you're from Chile, ask yourself, how much are people in Peru are trusting the people from Chile? Not so much, right? You can't go and do all kinds of things in one country. In this particular case, I think they're really angry that you call their national drink yours, right? I forgot the name of that drink. Pisco sour? No, I forgot. Anyway, but there's a lot of economic challenges, and that create level of distrust that then make it harder to collaborate. So I think that's why, even though the UN is not the most functional organization, and the World Health Organization might not be getting enough funding and support and collaboration, I think those things are crucially important. Okay, so I'm hoping, but on the background of competition, it's very hard to create this collaboration. Okay, another question from Steve. I mentioned that super spreaders could potentially set us back, but your example left the asymptomatic carriers. How can we educate people to be careful even if they aren't feeling well? Yeah, so I meant to include the asymptomatic, and that's really tough. So imagine, for example, a person who crossed paths with somebody with corona, So now I hear that I crossed paths with somebody with corona the day before. I have no symptoms, but I really have to go to work. Will I even go to be tested? Maybe I don't want to be tested because I don't want to know. You know, can we, and then if I'm tested and it's up to me to report, maybe I wouldn't report. So you're absolutely right. There's a question of what do we do with people who just can't afford the 2 weeks in isolation, right? And if you can't afford the 2 weeks in isolation, maybe you wouldn't be tested. Maybe you would be tested and you wouldn't tell anybody. And this is, again, a public goods question. So imagine that we took people that were tested positive and we say, you know what, if you need to go to isolation for 2 weeks, it's important for us. You might not be able to afford it, but for us, it's important. So we'll pay you to stay at home. Just imagine that was the case. Otherwise, how are we expecting people to stay at home? Can you imagine a person who's the sole breadwinner in their family? If they don't show up to work, they work on hourly wages, and all of a sudden you say, if you don't work, please don't work, but we're not going to pay you and your family will starve. Not going to work out. So it's a further, I think, an example of we're all in this together. And people who can't obey the rules, it's not because they're necessarily bad people. There are also some bad people, but we need to figure out if they can't obey the rules because they don't have the tools. It's important for us that they obey the rule. Let's help them do that. Okay, I'll take last question from Gigi Dunn. Do you think that our general trust in stranger is going to be compromised by this pandemic? Do you think if that were to happen, it would be cause for rise in individual and national security? Okay. So I think, you know, we will have better hygiene, right? If for the next 3 months we'll all wash our hands better, something from that will stay for a long time, right? We'll get used to it. I don't know about you, but I learned all kinds of things about thumb and all kinds of things about how to wash my hands, and I wash my hands more frequently and better. And it's a habit. I don't think about it anymore. It just now happens more frequently and better. Now, Gigi's question is: would we be afraid of everybody, or would we be more afraid of strangers? I think we would be more afraid of strangers. Everybody is a potential carrier, but the people that we are familiar with, we're going to have experience with. So imagine that I meet you every day and nothing happened for 3 months. I basically get trust in you because I know you and I've seen you, and my experience system tells me, you see Gigi, you shake her hand, you got close to her, you were in the same elevator, nothing happened. But people who are outside of our group, we don't have that experience as much. So I think that our anxiety, like, you know, the day that we'll go back to the office at Duke is a day in which I'll see more of the people I interact with on a daily basis. And after a while, we'll all realize that nothing bad is happening. And even if we keep social distance, I don't need to worry that much. Nothing is happening. If somebody new is coming, it's not that we're going to say, oh, this is a bad person, but we don't have the same experience with them. So we'll be at a higher level of alertness for that. And because we don't see strangers that often, if we saw them often, they wouldn't be strangers. I think there will be a bit more stranger anxiety. And would we then create more separation in society? I don't know, but it's a worrisome thought, and I think you can imagine that happening. You can also imagine things about other countries, being afraid of viruses that come with other countries. We'll see what rules would happen. So that's going to be complex. Okay, so our time is up. I don't want to finish with Gigi's question because it was so depressing. Thank you for it, but depressing. So I want to leave us maybe with the thought about where do we stand here. So we have lots of uncertainty, right? Think about kind of all the people in the world. From them we have people who are sick. From them we have people who are sick and know that they are sick. From them we have people who are very sick. From them we have people who sadly passed away. But the amount of unknown is tremendous. We don't yet know immunization, a cure. We don't know about herd immunity. We don't know about antibodies. There's just so much we don't know, and we'll find out. And I think the next month will be incredibly important to find out lots of things. But this uncertainty, both the health uncertainty and economic uncertainty, is very, very hard to deal with. What can we do? The things we can do are things about our life and take some control. So one thing that helps with control, but please don't do it, is shopping therapy. When we do shopping therapy, we feel we're making a change in the world. This coat was here, now it's mine. This bike was here, now it's mine. We make an effort. So that's a way to show control, but not the advisable one. There are other ways to show control. Start meditating, exercising, eating better, open rainy day saving account, start putting money into other things, have a long-term plan for something fun to do after the Corona time. Try and take control instead of, we're all victims of this global thing, but to be healthy, mentally healthy, we need to take control, even on small things. And with that, I will bid you farewell, and I'll say thank you very much for your time, and hopefully we'll meet again in not too long. Bye for now.